Hi there. I am Sarah. Let me explain to you the next topic. Culturally informed psychological assessment. But first, let me define what is culturally informed psychological assessment. It is an approach to evaluation that is keenly perceptive of and responsive to issues of acculturation, values, identity, worldview, languages and other culture-related variables as they may impact the evaluation process or the interpretation of resulting data. We offer this definition not as the last word on the subject but rather as a first step designed to promote constructive and scholarly dialogue about what culturally sensitive psychological assessment really is and all that it can be. So now, let us talk about planning a valid and culturally sensitive assessment. When planning an assessment that considers the culture, language or some related variable, to be valid, the culturally sensitive assessor can do this. Number 1. Carefully read any existing case history data. This can help to know the assessee's level of acculturation. You can also ask family, friends, or people who knows the assessee. But take note that if any such informants are to be used, it will be necessary to have signed permission forms authorizing the exchange of information to the assessee. Number 2. The assessor may consider a screening interview with the assessee. In here, rapport is established and the subject of acculturation, as well as related cultural issue are discussed. Number 3. During the formal assessment, the assessor keeps in mind all the cultural information acquired. This includes any customs regarding personal space, eye contact, and so forth. Number 4. After the assessment, the culturally sensitive assessor can re-evaluate the data and conclusions for any possible adverse impact of culture-related factors. If a translator is used, the interviewer must not be wary out only of the interviewee's translated words but of their intensity as well. And if the assessor used a member of a family to translate, make sure that the aide will be able to relate with the assessee. So that is how you are going to plan a valid and culturally sensitive assessment. But, another question is, how can culturally informed assessment best be taught? Formal instruction should occur in the context of a curriculum, and it should have 3 major components. First, it should have a foundation in basic assessment. Second, it should have a foundation in culture issues in assessment. Third, it should have a supervised training and experience. The process of culturally informed psychological assessment demands such shifting cultural lenses, with all forms of gathering information, including the interview. But what is shifting cultural lenses? The term shifting cultural lenses was defined by Stephen Regezer Lopez. He said that
situations are different from every culture. In discerning the appropriate meaning, one must first entertain both sets of meaning or apply both sets of cultural lenses, to test both ideas and be able to decide which will be used.
It is important to note that whatever decision is made, there usually exists some degree of uncertainty. But with multitude assessments over time, greater certainty can be achieved. And for your information, the notion of shifting cultural lenses is intimately tied to critical thinking and hypothesis testing. Did you enjoy my virtual character? How about meeting my real-life character? Come on, let's meet her.
Hi everyone! I am the real-life character of Sarah. Thank you, Virtual Sarah, for giving me the opportunity to discuss the topic. So now, let us continue. Cultural aspects of the interview. There are 9 various sources of cultural influence when assessing clients. And to help you to not forget it easily, just remember its acronym. Addressing. A stands for age, D stands for disability, R stands for religion, E stands for ethnicity, S stands for social status, S stands for sexual orientation, I stands for indigenous heritage, N stands for national origin, and G stands for gender. Whether using an interview, a test, or some other tool of assessment with a culturally different assessee, the assessor needs to be aware of ostensibly psychopathological responses that may be fairly commonplace in a particular culture. Diagnostic, conclusions, and judgments should attempt to distinguish veritable psychological and behavioral problems from behavior that may be deviant by the standards of the dominant culture but customary by the standards of the assessee's culture. It is important not to lose sight of how culture in the broadest sense may influence presentations and perceptions of pathological behavior. So now, let us move on with the special applications of clinical measures. Clinical measures have applications in a wide variety of research-related and applied settings. Let us begin with a brief look at some of the ways that clinicians evaluate aspects of addiction and substance abuse. So first, the assessment of addiction and substance abuse. A number of tests and scales have been developed to assist in the assessment of abuse and addiction. Did you know that efforts to reduce widespread substance abuse have led researchers to consider how culture may contribute to the problem and how culturally informed intervention may be part of the solution? Using a wide variety of measures, researchers have explored substance abuse in the context of variables such as cultural identity, generational status, religious beliefs, and sexual orientation. Now, let us discuss the ethical considerations when assessing substance abusers. In research contexts, it is important to address the concerns obtaining, first, fully informed consent to assessment. It is important to ask for permission before conducting the assessment. Any payment offered to substance abusers for participation in a research study may appear coercive. So, let's do that one. After ethical considerations, let us go to the topic of forensic psychological assessment. The word forensic means pertaining to or employed in legal proceedings. And the term forensic psychological assessment can be defined broadly as the theory and application of psychological evaluation and measurement in a legal context. In the forensic situation, the clinician may be the client of a third party and not of the assessee. Another difference between forensic and general clinical practice is that the patient may have been compelled to undergo assessment, unlike the typical client seeking therapy. For example, the assessee is not highly motivated to be truthful. Consequently, it is imperative that the assessor rely not only on the assessee's representation but also on all available documentation, such as police reports or interviews with persons who may have pertinent knowledge. Even though some have challenged the role of mental health professionals in this and related matters, judges, juries, district attorneys, the police, and other members of the criminal justice system rely on mental health professionals to provide them with their best judgments concerning such critical questions. And these are dangerous as to oneself or others. Ano to sinusuot ko? Hindi ako nananakit. I will not hurt you. So please, take this off from me. Papatay mo kayo. If the assessor determines that a homicide is imminent, the assessor has a legal duty to warn the endangered third party. And if we say duty to warn, it is defined as a duty that overrides the privileged communication between psychologist and client. Second is the competency. Ano mag-ano po sa court. Ano sa court? Mag-ano sa court? Ano yung nakita ko? Ewan? Di ko alam. Mandates that a certain propriety exists with respect to state-ordered executions, because, it would not be morally proper to execute insane persons. Third is the criminal responsibility. Ayan, hindi ko siya pinatay. Experiment ko yun. Oo. Ganito, scientist kasi ako. Tapos yung experiment ko, kung yung mortalidad ba niya, di na maano. May in-inject kasi ako. Ano ba yung in-inject ko? Ay, hindi ko alam. Basta, science. Hindi nyo maintindihan yun, pero, hindi ko siya pinatay. May in-inject lang ako. Tapos, tinignan ko kung mamamatay ba siya. Kaya, tinanong ko siya. Right or wrong test, or the Egnaton standard, is used in England as well as in a number of jurisdictions in the United States. However, a problem with the right or wrong test is that it doesn't provide for the acquitting of persons who know right from wrong, yet still are unable to control impulses to commit criminal acts. Psychologist Richard Rogers and his colleagues designed the RCRAS, or the Roger Criminal Responsibility Assessment Scale. As a systematic and empirical approach to insanity evaluations, this instrument consists of 25 typing groups, both psychological and situational variables. The items are scored with respect to 5 states. First is the reliability. Second is the organic matters. Third, psychopathology. Fourth, cognitive control. And the last one is the behavioral control. Now, let us move on with the diagnosis and evaluation of emotional injury. Many tools of assessment may be used in the process of evaluating and diagnosing claims of emotional injury. Just like profiling. At the core of profiling, it is the assumption that perpetrators or serial leave more than physical evidence at a crime scene. They leave psychological clues about who they are and personality traits that they possess and how they think. Custody evaluations. It is a psychological assessment of parents or guardians in their parental capacity or of children and their parental views and preferences. It is usually undertaken for the purpose of assisting a court in making a decision about awarding custody. We also have the evaluation of parent. The evaluation of parental capacity typically involves a detailed interview that focuses primarily on various aspects of child rearing, though tests of intelligence, personality, and adjustment may be employed if questions remain after the interview. And during the course of the interview, the assessor may find evidence that the interviewee really does not want custody of the children, but is undertaking the custody battle for some other reason. For example, alam mo Day, si Ronnie, napakasaya niya nung araw na yun. Alam mo kung bakit? Kasi nag-grant yung annulment namin. Tsaka hindi naman ako magpapatalo. Akala niya siya lang yung masaya. Tingnan niya lang. Gagamitin ko yung bata. Siyempre, 7 years old below pa yung anak namin. At yung custody, I'm sure, ibibigay sa akin. Because I'm the mother. Humanda siya. Parents may be employing the custody battle as a technique of vengeance to threaten, to take away that which is most prized and adored by the spouse. Evaluation of the child. The court will be interested in knowing whether the child in a custody proceeding has a preference with respect to future living and visitation arrangements. If intelligence test data indicate the child who is chronologically 5 years old is functioning at a higher level, then those preferences will be accorded greater weight. Child abuse and neglect. The abuse may creation or allowing of infliction of physical injury or emotional impairment that is non-accidental. Ikaw ang bata ka. Ba't ka pumunta doon, ha? Ba't ka pumunta doon? Mami, wag po. Gusto ko lang naman po maglaro sa labas. The creation of allowing the creation of substantial risk of physical injury or emotional impairment that is non-accidental. Uy, Mare, napansin ko lang sa bahay niyo kasi parang hindi maganda yung pagkakagawa nung lalagyan niyo ng mga gamit kasi parang napaka-delikado para sa mga bata. Alam mo, huwag kang mangyalam, ha? Kung masugatan man yung bata ko doon, di mo na problema yun. Kasi, gusto ko ganun na design. At walang makakapigil sa akin. Okay? Kaya, huwag kang makialam ng ibang buhay. Check. Or, the committing or allowing of a sexual offense to be committed against a child. Wag po. Wag po. Neglect. Neglect may be in form of physical signs that may or may not indicate neglect includes dress that is inappropriate for season, poor hygiene, and lacking physical development. Physical signs indicative of sexual abuse. In young children, physical signs that may or may not indicate sexual abuse include difficulty in sitting or walking, itching or reported pain or discomfort of genital areas, stained, bloody, or torn underclothing, and foreign objects in orifices. Baka mapansin ni Mama. In older children, the presence of sexually transmitted disease or a pregnancy may or may not signal child sexual abuse. The child abuse potential or CAP has inventory demonstrated impressive validity in identifying abusers. Another test, the Parenting Stress Index, measures stress associated with the parental role. Parents who physically abuse their children tend to score higher on the PSI than parents who do not. Parents who score high on the CUP and the PSI could be given priority for placement in the parenting skills class. Individualized parent training, child care assistance, and other such programs. Elder abuse and neglect.
Anak, pwede bang humingi ng pagkain kasi gutom na ako.
Ma, busy po ako, okay? Punta na ako. Busy ako. Bukas ka na lang kumain. Adult Protective Services is called the TRIO or TRIO, an acronym for the Tool for Risk Inventions and Outcomes. It is used in identifying elder abuse among members of a culture-specific group, such as members of Native American population. Culture-specific instruments such as Native Elder Life Scale or NELS may be the test of choice. And for the last one, suicide assessment. There are in many instances telltale that signal suicide ideation or an intended suicide gesture or attempt. And clinicians must be vigilant regarding patient communications that convey direct or indirect or disguised reference to suicidal intent. As we have seen throughout this group, there are many different tools of assessment and many different ways that the tools can be used. If these tools have anything at all in common, it is that their use by a professional will at some time or another culminate in a written report. In clinical and counseling settings, that report is referred to simply as the psychological report. So that would be all. I hope you understand the topic about culturally informed psychological assessment. I am Sarah, your reporter for today. Have a good day.